First of all, you might remember late last week, we got the sort of astonishing news that sort of flummoxed me on the air. I kind of lost speech about it for a second. But we got the news late last week that the U.S. had hit a single-day vaccination record of over 3 million vaccination shots delivered in a single day. And I know big numbers just sound like big numbers, but it was nearly 3.4 million shots in one day. And if you want that in context, what that means is that in one day, in a single day, we vaccinated more than 1% of the entire U.S. population at the end of last week. That is stunning. Even more stunning, it turns out that we kept up that pace over the weekend. Looking at the numbers for today, it turns out that over the last 4 days, Friday, Saturday, Sunday, and today, Monday, the total number of vaccination doses given in this country was about 12.6 million, which means in 4 days, we kept up that pace. In 4 days, we vaccinated nearly 4% of the U.S. population, which is just astonishing. I mean, if you keep up that pace or hopefully even increase that pace, it just means we're going to get there. Like, it's in sight. We can keep doing it at this pace. We can get there. We can speed it up. We can get there. According to the White House, more than a third of all American adults, more than a third have now received at least one dose of the vaccine. 36% of all American adults. If we can keep up this pace, vaccinating 1% of the population every day, let alone, it's an even larger proportion of adults. And if we can keep up this pace, we've got more than a third of the population having at least one vaccine dose now. We could double that in about a month if we keep up this pace, which would get us very close to where we need to be. I mean, imagine how different our prospects will feel if we've got 70, 75, 80% of adults in this country vaccinated. And younger people are starting to get vaccinated too. President Biden today announced a big expansion in terms of the distribution of vaccines to pharmacies. And this is interesting, something I actually want to talk to Dr. Walensky about. It seems like getting your vaccine through a local pharmacy is turning out to be the most popular, if not among the most popular way for Americans to get their vaccines. It does depend from group to group and place to place, but that means that finding is causing the Biden administration to double down on that as a route for vaccines. Right now, the federal government is getting vaccine supplies to 17,000 pharmacies. President Biden announced today that that number will go from 17,000 pharmacies to 40,000 pharmacies, more than doubling it. President Biden said today, with the number of doses distributed continuing to rise each week, and with those 20,000 plus new pharmacies coming on board to administer shots that haven't been giving them thus far, but will be soon, President Biden said today that by April 19th, 3 weeks from today, 90% of all American adults will be eligible for the vaccine, and 90% of us will have a place administering the vaccine that's within 5 miles of where we live. And that is phenomenal news if it pans out. It also comes out alongside some scientific news about how the vaccines are working. That's honestly the data I feel like I've kind of been waiting for. I've been really focused on this issue of treatment for people who do get infected with COVID. Can we offer them a cure? Can we offer them something that will keep them from getting sick, keep them from going to the hospital, keep them from dying? I've talked about that a lot on the show. You've probably seen it. But the other thing that we've all, I think, been waiting for in terms of vaccines is how much vaccinating everybody gets us closer to the end of there being a coronavirus epidemic in this country. Right? And there is a piece of scientific data we know to be able to answer that question. Don't just think about it in terms of whether we individually are going to survive it. Is the country going to end our coronavirus crisis by vaccinating enough Americans? It's a piece of information that we have needed. Today we got it. We all know already, right, that if you get vaccinated, that vaccine will basically prevent you from getting sick with COVID. It will prevent you from having to go to the hospital with COVID symptoms. It will prevent you from dying from COVID. Great, good for you. But there has been this scientific gray area about whether, once you're vaccinated, you can still get infected. It may not be an infection that will give you symptoms. It may not be an infection that will send you to the hospital. It may not be an infection that will kill you. But can you get infected with mild symptoms or no symptoms, even if you have been vaccinated? That's an important thing to know. Right? Because even if vaccinated people themselves aren't going to get sick from COVID, the prospect that by getting vaccinated, you might protect yourself But you could still potentially get infected, not have any symptoms, and then unknowingly pass it on to other people. You'd be protecting yourself. You'd still be a risk to others. That prospect has been looming. And that uncertainty has made it woollier and harder to think about how really your life is actually going to change all that much if you're vaccinated, but you're still potentially a risk to any non-vaccinated person. Getting a hold of that information about whether you can get infected once you're vaccinated and potentially pass it to somebody else, that's really important. Well, today the CDC reported new data that shows that under real-world conditions, not just in a lab, not just extrapolating from tiny numbers of test subjects, but looking at thousands of frontline health workers and essential workers who got vaccinated and who have since been doing their jobs and living in the real world, not only are the vaccines for those folks, thousands of them, keeping those people from getting sick from COVID themselves, those vaccines are also highly effective at preventing those people from getting infected, even with non-symptomatic infection. And if you are not infected, you can't give it to anybody else. And I know this sounds like an incremental piece of news, but sit on this for a second enough to absorb what this means. Right? What this means is that we can get there with vaccines. We can end this thing. It means that instead of the vaccine being able, instead of the virus being able to hop from person to person to person to person, spreading and spreading, sickening some of them, but not all of them, and the ones that it doesn't sicken don't know they have it, and then they give it to even more people because they didn't recognize they were, right? Instead of the virus being able to hop from person to person to person, potentially mutating and becoming more virulent and drug-resistant along the way, now we know that the vaccines work well enough that the virus stops with every vaccinated person. A vaccinated person gets exposed to the virus. The virus does not infect them. The virus cannot then use that person to go anywhere else. It cannot use a vaccinated person as a host to go get more people. That means the vaccines will get us to the end of this if we just go fast enough to get the whole population vaccinated. It's huge news. Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.